Latest fiasco, the Mr. Fit study. Mr. Fit means multiple risk factor intervention trial. 12,000 men are on a greatly elaborated American Heart Association trial. 6,000 men on their new and improved diet, which is like the old one. 6,000 men on the regular American diet. The study is going to cost you at least $100 million, the 6-year study. It's going on now for 2 years already, and they haven't made their goals yet, but here are their goals. Here are their 6-year goals. In 6 years, they hope to achieve a 10% reduction of cholesterol level. Now, we achieve a 10% reduction of cholesterol level in 6 days, not 6 years. Now, let me tell you the virtue of reducing cholesterol 10% in 6 years. If your cholesterol is 300 and you reduce it 10% to 270, the Framingham study tells us that you still have 400% greater risk of heart death than if you're down to 220. So what's the point of bringing it down to 270? Yet that'll satisfy the American Heart Association and the National Institute of Health that's doing the study. The study obviously is going to fail because it's another one of these studies where they're trying to use a dietary program that is no change from what you're normally eating, just give you a change in the kind of fat. How about drugs? The big coronary drug project, which is a 5-year double-blind study, 8,300 men. They used the best drugs they had. They used niacin, the vitamin. They used Artemis, they used estrogens, they used thyroid, and they used placebo. Placebo is that empty capsule with no drug effect. At the end of the 5-year study, it was a marvelous study, cost you over $40 million, but it was the best dollar you ever spent. Because at the end of the study, there was only one capsule that proved to be the most effective. The least amount of side effects, the least amount of problems, and that was placebo. So it cost you $41 million to find out that there isn't a drug that we have that can help your heart disease. Even though all the other drugs lowered cholesterol level, they didn't reduce the death rate. And we all know about surgery, coronary bypass surgery, very popular, probably 100,000 cases next year will be operated on. But we also know that 20% of all bypasses close in the first 12 months. So you're not going to get very far with conventional medical care on coronary heart disease. Unless you go right to the cause, which is the diet, the high cholesterol, high fat American diet, there is no hope to make any progress. Now, how about the other degenerative diseases? And I should mention that before we go into the others, that we do know there is hope for changing the situation. We do know about the human studies and the primate studies that show if you lower the fat and cholesterol sufficiently, you can have reversal of artery closure. There's 4 human studies so far reported in the last 2 years, and many, many primate studies, Dr. Whistler, University of Chicago Medical School, Dr. Mark Armstrong, University of Iowa Medical School. And the reversal of artery closure all has been accomplished by taking the cholesterol and fat out of the diet. The cholesterol is a principal factor, the fat is a secondary factor. The problem of diet with other factors such as sight and hearing. Hearing, we know, is related to the amount of oxygen that reaches the hearing organ. And if you're a smoker, you can detect in a few weeks a loss of high-frequency hearing. If you stop smoking, you can gain a certain amount of your high-frequency hearing. On the other hand, if you're on a high-fat, high-cholesterol diet and you close up the vessel that feeds the ear, you gradually lose your high-frequency tones. And it's so predictable that in our country, we can predict, an expert can, your age within 5 years by taking a hearing test and seeing how much of your high-frequency tones have been lost. So hearing is not an inevitable loss that has to occur with aging. We know in countries on low-fat, low-cholesterol diets that their hearing lasts 40 years longer than they do in our country without loss. So we know how to handle that. And we know there are many cases where some hearing is restored when the diet is changed. How about glaucoma? Glaucoma is a disease, a problem only of Western countries. In countries on low-fat, low-cholesterol diets, glaucoma is never found. It's rarely found, unless it's a very acute disease state. But glaucoma is normally never found. That's a problem with high-fat American diets, too. So our principal problems of loss of sight, glaucoma, cataract, sudden blindness, these are all dietary related. In fact, the diabetic problem, we call it diabetic retinopathy, the disease of the retina, if you're diabetic, is responsible for the major amount of blindness in our country. I believe 17% of all new blindnesses are from diabetics. So we certainly have to give some thought to the problem of sight. Even though we feel that the hearing loss and others are related to age, we begin to realize that that's not really true. Gallstone problems are considered something you joke about, but gallstones are no fun if you have them. They're probably the most intense kind of pain you can have, and they're considered relatively minor, but there's 300,000 operations a year to take your gallbladder out, and 6,000 people die from these operations. Yet we find that gallstones are almost completely avoidable by changing diet. The gallstone starts because cholesterol crystallizes in the gallbladder. The bile in your gallbladder gets to have a cholesterol level of 600 to 900 if your cholesterol level in your blood is 250 or so. Cholesterol in the gallbladder is 3 times as high as it is in the blood. When it gets to be 600 to 900, it's so concentrated it almost has to crystallize. And once you form one crystal, another will form, and the 2 crystals stick together. They'll join with a third, and now you have the making of a small gallstone. Because the gallstones in the American countries are cholesterol gallstones, and they just roll together like a snowball, and that's the way you grow them. In tests on humans, we find that if you take the cholesterol out of the diet, the crystals in the gallbladder dissolve and disappear. And if you restore the cholesterol to the diet, it just takes 2 or 3 weeks before the crystals come back. So gallstones have been a mystery for many years. It's no longer a mystery because gallstones can be avoided. They never have to happen. And although we don't consider it a matter of life and death, it's certainly not the kind of thing we would like to have. Arthritis is a nuisance. It doesn't kill anybody to speak about, but it certainly makes you unhappy for many years. And we know there's different kinds of arthritis. There's gouty arthritis, when you have too much uric acid in your blood. And we know that too much uric acid comes from eating animal products. It's the only way just about you can get it. And if you have too much uric acid, it can turn into crystals, and the crystals can be eaten then by your white blood cells. The white blood cells die in the process because they can't digest a uric acid crystal. And when they die in the process, the little stomachs of the white blood cells explode. All the powerful digestive juices come out of these little stomachs right into your joint spaces, and they just irritate your joints, digest your joints, corrode your joint spacings, and the pain is, of course, tremendous. Gouty arthritis is practically 100% reversible when you lower the uric acid level in your blood by lowering the animal protein content of your diet. Rheumatoid arthritis is a little different. But all of the arthritises that are commonly known, rheumatoid arthritis, osteoarthritis, are all problems where the digestive juices of your white blood cells, your own white blood cells, get into the joint spaces and start to digest your joint linings. It's a tragedy that we create a condition in your body that destroys your own white blood cell, which is your first line of defense, and by their destruction, the juices come out, the little digestive juices come out, and destroy your own joint tissue. That's real suicide. The way it happens with rheumatoid arthritis is that the low oxygen levels that we find in the joint spaces, because on the American diets, low oxygen levels are created, as you know, by a high-fat diet. The red blood cells stick together so they can't pick up oxygen, or by smoking. But either way you do it, if the oxygen levels get low enough, these white blood cells have their little stomachs enlarged and enlarged until they burst like a balloon. Their digestive juices spill out, get into your joint space, cause you the rheumatoid arthritis. Osteoarthritis is very similar. The little white blood cells burst again because the oxygen gets low, and when they burst and the digestive juices get out, the little cartilage cells, the ones that make your cartilage in your joints, that's your joint lining, the cartilage cells sort of go crazy, and they produce, instead of nice flexible cartilage to line your joints, they produce a stone-like, bone-like cartilage. And only when the juices, digestive juices, go away, when you don't create new deaths of white blood cells, does your osteoarthritis stop happening. All these things happening because of your own cells reacting to lowered oxygen levels. Diabetes is a disease that goes back thousands of years. It's sort of a tragedy because it's so destructive to the body. Of every gangrenous limbs that come to the hospital to be amputated, 80% belong to diabetics. Diabetics have 3 times as many deaths from heart disease as non-diabetics.